The World Health Organization is taking the Mpox outbreak very seriously. They have declared it a public health emergency of international concern. This is the highest level of alert the WHO can issue. It means they believe the Mpox outbreak is a serious threat to global health. The WHO wants all countries to work together to stop the spread of this virus. This is not the first time the WHO has declared a global health emergency. They did the same thing for COVID-19. This shows how concerned they are about Mpox. They are worried that it could become a pandemic like COVID-19 if we don't act quickly. The WHO is urging countries to take steps to prevent the spread of Mpox. They also want countries to be prepared to treat people who get sick. The WHO is providing guidance and support to countries to help them respond to the outbreak. The global health community is watching the Mpox outbreak very closely. They are working hard to learn more about the virus and how to stop it. Mpox is spreading quickly across the globe. It has reached over 75 countries. This is a big jump from just a few years ago. Mpox was once confined to a few countries in Africa. Now it is a truly global threat. The majority of Mpox cases are in Europe. However, cases have also been reported in North America, South America, Asia, and Australia. This shows that the virus can spread easily from person to person. It also highlights the need for international cooperation to stop it. While Mpox can infect anyone, the current outbreak is primarily affecting men who have sex with men. This group is at the highest risk of contracting the virus. It is important to note that Mpox is not a sexually transmitted infection. It can be spread through any close contact with an infected person. Mpox can cause a range of symptoms. Some people only experience mild symptoms. Others get much sicker. It is important to know the signs of Mpox so you can get treatment quickly if you need it. The first sign of Mpox is usually a fever. You may also experience headaches, muscle aches, and swollen lymph nodes. A rash will appear a few days later. This rash can look like pimples or blisters. The Mpox rash often starts on the face and then spreads to other parts of the body. It can be itchy and painful. In severe cases, the rash can cover the entire body. If you develop a rash, it is crucial to see a doctor immediately. Section 4. How Mpox spreads. Mpox spreads through close contact with an infected person or animal. This includes direct contact with bodily fluids, such as saliva, blood, or pus. It can also be spread through contact with contaminated materials, such as bedding or clothing. You can get Mpox from touching the rash of someone who has it. You can also get it from contact with their respiratory droplets. These droplets are released when an infected person coughs or sneezes. It is important to note that Mpox is not as contagious as some other viruses, like measles or chickenpox. It is spread through close contact, not casual contact. This means you are unlikely to get Mpox from simply being in the same room as an infected person. Section 5. The WHO's plan to fight Mpox. The WHO has developed a comprehensive plan to fight the Mpox outbreak. This plan involves working with countries around the world to implement a range of public health measures. The goal is to stop the spread of the virus and protect people from getting sick. One important part of the WHO's plan is to increase surveillance for Mpox. This means tracking cases of the virus and identifying people who may have been exposed. The WHO is also working to increase access to testing for Mpox. Another key aspect of the WHO's plan is to ensure that people who are at high risk of contracting Mpox have access to vaccination. This includes healthcare workers, men who have sex with men, and people who have close contact with infected individuals. Section 6. Protecting yourself and your community. There are several things you can do to protect yourself and your community from Mpox. These simple steps can make a big difference in stopping the spread of this virus. First, practice good hygiene. Wash your hands frequently with soap and water. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your face, especially your eyes, nose, and mouth. Second, avoid close contact with people who are sick. If you know someone who has Mpox, stay away from them until they are no longer contagious. If you develop any symptoms of Mpox, see a doctor immediately. Finally, stay informed about the Mpox outbreak. The WHO and other public health organizations are regularly providing updates on the situation. Pay attention to these updates and follow the advice of public health experts.